So I'm a board-certified gynecologist, but my focus here is gender and sexual health. Here at Legacy, our goal is to take care of all patients, and that includes transgender patients. And so we provide services to our community. We have a group of doctors who are pediatricians, primary care, gynecologists, and plastic surgeons who are committed to transitional care. Transgender patients have all the same problems we all have. They need their gallbladders out, they have high blood pressure, so we also need to have a group of physicians and hospitals, urgent cares that are trans-friendly and provide culturally competent care. A lot of the patients come in and they have complaints. They have bleeding or pain or discomforts, or their blood pressures are out of control. And when we get down to really what's bothering them is they don't feel comfortable in their body. And what they're really complaining about is their dysphoria. And once we treat that dysphoria, they can start taking care of their body. And gender dysphoria is this disconnect between the sex that you were assigned at birth and how you feel internally. Most of the time, those two things match for us, but sometimes they don't. And when they don't, it causes a lot of distress about our body, anxiety, depression, and that's what dysphoria ends up being, is that distress, that anxiety, that depression regarding that disconnect. So my patients come in reporting really a wide variety of experiences with other doctors and other healthcare systems. Some are met with just confusion about what it means to be transgender, and so the patient has to educate. Others are met with sort of dismissal of like, that's great, good luck, but we're not going to really be able to take care of you here. Other patients report that they have to answer a lot of inappropriate questions before they can get the care they deserve. I think that most providers just don't know where to go or how to help, but we have to do better. Healthcare is life-saving for a couple of reasons for transgender patients. The first is that we know that 40% of transgender patients will attempt suicide in their lifetimes, and that's way above the normal rate for everybody else. And so we know that if we treat them, as in we give them transition, we actually reduce that to about 8%. If you have a disconnect between your body and your mind, you don't take care of your body. So you don't check your blood sugars, you don't take your medicines, you don't care for your body. And when we help people transition, they start to care for their body, and that actually is all about their health and can save their life through other means. I think the biggest change to healthcare since I've started here has been the insurance changes. Insurance actually covering transition-related care, gender-affirming care. The biggest part has been Oregon Health Plan, but actually we have in Oregon a number of privately insured companies that have actually insisted that transgender healthcare be in part of their insurance plans, and that's been a huge, tremendous change for us. Legacy has actually been tremendously supportive for my practice. They've, as well as all the other physicians who work for Legacy, they allow us protected time, they support us going and testifying for Oregon Health Plan. They've changed their own policies towards their own employees so that our insurance covers gender-affirming care as well. I think the future of gender-affirming care for transgender patients really is wraparound care. It's actually taking care of the whole patient and the whole community at once. It is not just providing surgeries and hormone, but providing all the other parts, therapy, voice therapy, all those things together so that patients come to one place and get everything.